Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have any questions or concerns or seeking advice, diagnosis, and or treatment, please seek individual, personalized advice from a healthcare provider in your area. We are not liable for any risks or issues associated with using or acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride. Welcome to Medical Media Mixer, the perfect cocktail. I'm Nicole Peniston, psychologist.
And I'm Tara Prisco, physician assistant.
Okay, before you say anything, I have to ask, it felt like that countdown was way longer.
Maybe they were pausing for dramatic effect.
Like it used to be like 5, 4, 3, 2, 1. I'm like, oh. And now I was like, oh, I have a lot of time.
I'm not quite sure. So tell us all about Sonoma, Napa, all the wine places.
So we didn't, in my mind, we didn't do a ton of wine places.
There was a whole day that every social media post was a wine stop.
Well, we went to 4 wineries in one day.
Okay.
That being said, myself in New Jersey with friends, who you also know, we've done 3 wineries in one day, just in New Jersey.
True.
So I guess within context, it wasn't a lot, but it's, we went and we did the tour and we drank and hung out. So it wasn't rushed.
Mm-hmm.
And then I did 2 other wineries just by myself. One, Deb was there, but she just didn't feel like drinking, which I'm like, what? This is why we're here. And that was the first day. And I'm like, really? We just got here. And then the second one, I was oot and a boot shopping. She was laying at the pool. And so they have a lot of tasting rooms. So I just popped into one of the tasting rooms that I had been eyeing and did some tastings there.
Nice.
And that was what I meant to tell you before. I was networking a lot of the tasting rooms, being like, oh, well.
That's how I met our bartender friend that we're going to be featuring at some point. Was it at a whiskey tasting place?
Yes.
Moonshine.
And I tried to go to a distillery, but they were closing. Literally, they were like, we have 5 minutes left. I'm like, that's not enough time.
No. So. Nice.
But yeah, it was a nice trip. Beautiful weather. We had no rain. It was mid 70s the whole time.
I feel like that's the perfect place for weather there. And it's you're driving through the fields.
Yeah, so gorgeous. We definitely need to do a girls trip. I feel like you, me, Chris, Kim, a couple other people.
Yeah.
It'll be so much fun. But we can't even get dinner together, ladies.
Yeah.
Because it ain't me, girls. I know you have bigger lives than I do, but still.
I am seeing Laura next week. We're going to Dave Matthews concert.
Well, it would have been nice if she told me she's going to be in New Jersey to just say hello.
I don't know if she's just coming in, coming out.
Still, she can just say, hey, girl, hey. But no, I think it would be a really fun girls trip. We did a spa. I did a mud bath. That was an experience.
Good, bad?
Good for the most part. I don't know if I would do it again because it was a little overwhelming, being submerged in the mud.
Would you say it's a sensory overload?
I would say it's a sensory overload. I like being pulled tight, but this was heavy and tight, and I didn't like the feeling of that.
I gotcha.
It was a little like being smothered by a warm, wet, weighted blanket.
Okay.
Yeah, so
interesting. So there is a movie, the Wine Country movie.
Yes,
it's a girls' trip
with Amy Poehler.
Yeah, and they all stay in a house and all that.
We need to do it that way. That
pretty much.
Yeah. But no, it was fun. We ate at some really good restaurants. The scenery was beautiful. Everybody was really nice. There were some cute little shops and stuff. The mud bath I liked, but I feel like you and our listeners would enjoy this story because you've already gotten to know Deb. You've heard enough anecdotes this far that you guys know her.
Follow Deb on Instagram.
Yes, Debbie and her drinks on Instagram. It's exactly what it sounds like. Debbie and her drinks. So the mud bath was this whole ritual where you got a massage and then you sat in the mud bath and then you rinsed off and then you had a mineral bath and then you rinsed off and then you were in a warm blanket wrap. And I'm in my warm toasty blanket wrap and I'm relaxing, semi falling asleep, and it's quiet and it's the spa music. It's soothing. And then all I hear, Nicole! My mom was looking for me and was wandering unattended through the spa with her camera because she wanted to take a picture of me in the mud bath.
And people are half naked, what is this woman doing?
So luckily she was stopped before she could get back into any inappropriate areas or take any photos. But I was just Mom, it was so nice and relaxing. It was and then I just heard you call my name and it was just all gone. She was I just wanted a picture. You could put it on your Insta. I'm oh my God, stop it. So, but we still had fun. And that night we ate at the best restaurant of the trip, which was a little plug for them. Their name is Evangeline. They're in Calistoga. And it was like a soul food, Southern kind of Creole restaurant, but drinks fabulous, food fabulous, ambiance fabulous. So
nice.
yeah, it was a really cool place. That was a place in my pictures that was like the garden terrace.
Okay.
Yeah, it was really
That's
cool.
kind of just like the perfect trip. I went just a day trip to wine country from San Francisco. Like I went out with a conference with Anthony well before we had children. We rented a car and just like drove through. But it's just pretty. It's fun.
Yeah.
It's nice. The weather's good.
Yeah, it was a fun trip. I would definitely go back again with the girlies so we could get into a little bit more shenanigans, but we had a nice time.
A little more trouble.
Yeah, a little
good
bit.
Trouble.
Yes, just a little bit of good trouble.
My week was not so exciting compared to yours.
Well,
I weeded the yard. We planted some trees.
I mean, 'tis the season, so it's
I got the pool chemicals hopefully correct, but it was too
cold.
cold.
To come over for a swim.
I know it was too cold. This whole like holiday weekend in Jersey was cold. Monday it was like in the 70s, and we put the heat up to 90 on the pool. We're like, okay, kids, go in. Yeah. They were fine. I was still in a sweatshirt, but they were fine.
Yeah, it'll get there. We don't want the really hot heat too soon.
So. True. And the rain is good for the things I just planted. So
yeah, great.
So this is the first week we're doing a different format. We're doing just one story, trying to kind of make it a little more relaxed, a little less rushed, a little more time for chit chat. So Nicole is up this week.
That's me.
I'm very excited to hear about your drink because of these special thingies that are in your drink.
So I'm very excited too, because in my drink, let me tell you about the drink first, and then I'll tell you the minor mishap I almost literally just had on camera while you were talking. Literally just happened. So I am calling my drink the Sensory Overload Cocktail, but it is technically called the Pomegranate Champagne Cocktail with Szechuan Buttons.
It's a very long name. Yeah.
It is. It basically is just the ingredients, because it's only 3 ingredients, and those 3 ingredients are all in the title. So what it is, I will also say I didn't measure it out. I just poured crap in my cup, so we'll see what happens. But it's supposed to be 1 tablespoon of pomegranate simple syrup. Pro tip, grenadine is just pomegranate simple syrup.
Yeah, true.
Yes. Then 1 glass of your favorite champagne. I used the cheap stuff, sorry. And then a half a teaspoon of Szechuan button petals. So I ordered mine off of Etsy. Shout out to, I have their seller's name, Garden Q on Etsy. And they gave me the whole buttons, which I didn't realize until I threw it in the drink. And then I was like, oh, so I ripped it apart, as you saw. But Szechuan buttons, for those who don't know, are also called the toothache flower.
Okay.
And it has a Novocaine-like effect.
Okay.
And so after I ripped it up with my fingers, I'm like, oh no, are my fingers going to be numb? I don't want to touch my eyes. I was just freaking out. I don't know what this is going to taste like. This is literally.
Am I going to watch you paralyzed virtually? And I'm going to be like, Nicole, call 911.
So the background for this is I watched this film called Sensory Overload on Hulu, which I'll get into in a minute. And then I was like, well, a sensory cocktail was really cool. I bet that's a thing. So I Googled it, and it is a thing. But it is really kind of an in-house bar restaurant type of thing, because a lot of it involves dry ice for that effect, or certain scents or smoke, or all these cool things that I don't have the time or energy for in my house. So then I was looking, and a lot of those cocktails also contain this Novocaine flower or whatever it is. And so I ordered some, and I'm going to try it, and we'll see.
All right, let's see. How does it go?
It's good. I don't know if I'm supposed to eat this. I think I am.
I don't think you should. I don't need you paralyzing you.
So all I taste is the pomegranate and the champagne. So I have a very tiny seed right here. So I'm going to eat this part. I know they are edible, so I'm not going to die.
I'm watching something
I don't taste anything. I think that one's too small. Let me find another little one.
What do we got?
Okay. The closest thing I could equate it to, and I still only got a little bit of it. I think the sensory is more on the outside of the flower, and I got kind of just a piece of the inside with some of the outside. I would equate it to a combination of, it's kicking in now, it takes a combination of one of those really super red hot cinnamon candies, and then numbing. The tip of my tongue feels like it's numb. I got Novocaine on it.
Interesting.
Yeah, I don't hate it.
Yeah.
And then with the champagne, the bubbles kind of throw off the senses too. And then the pomegranate, which I've had before, but never quite as much. It's very sweet. So it's the bubbles, the sweet, the numbing. It's pretty cool.
Interesting.
I'll have to bring you some buttons, because I have
I can just throw them in random drinks and see what happens.
I have a 1/4 ounce of them, and I'll show you. They're very small, so it's quite a bit to have that many of them. This is just what one is. If you can see.
I see.
And all that yellow stuff on the outside is the tingly stuff.
I made version 2.0 of the perfect cocktail in my experimentation.
Ooh. Does it need Szechuan buttons?
I mean, maybe.
That would be cool.
So I did that same infused vodka that I had made. So the lemon lavender infused vodka that has a little sugar, so it has a little syrup to it. So I did like 1 shot of that, half a shot of elderflower, and then liqueur, and then Prosecco just over ice. And it's tasty, but I feel like I think what you've been saying with the creme de violet might be the key to something different, and it's something purple and something cute. So we'll have to, next time when I go,
yes,
you have to make a purple drink with creme de violet because you have it at your house.
I can do that. But also I was going to say, one of the drinks I had when I was away had creme de violet in it, and it was delicious. And I believe I did take a picture of the menu to make it at home. So
there you go.
Coming soon.
The perfect cocktail.
In progress. We're all perfect cocktails in progress.
Yeah.
Did I just make a slogan for a t-shirt?
Yes. We are all the perfect cocktails in progress. Write that down, theoretical producer that we don't have.
I was going to say, who are we telling to write it down? We don't have
this person that does all the background work for us.
Child number 1? Child number 2?
Maybe.
Yeah. They're both very creative. I'm sure they could come up with some kick butt merch for us.
That's true.
So today I'm going to talk about the film called Sensory Overload. As I said before, it's found on Hulu. It's relatively short, 55 minutes, and it's a documentary. Now, I will say this. I watched it. I enjoyed it. Obviously, I'm going to talk about it, so I think it's relevant and valid. But I think a preference to all of this is it's sponsored by Sensodyne, the toothpaste company. Because there's a large part of it talking about how going to the dentist can be a very sensory, difficult experience for a lot of folks. And so I think I like where they're going with it, where they're trying to be mindful of people who have sensory processing disorder, which I'll get into in a minute, and how going to the dentist can be particularly difficult. And we all know that our dental health is important. But it just also at points feels like an extended commercial.
Mm-hmm.
And I would say my one critique of it, other than it seeming like a commercial at points, is that they really only talk about sensory overload in terms of people who are neurodivergent, aka they almost solely focus on people with autism. Now, people with autism can and often do have sensory issues, but not all of them may have sensory processing disorder proper.
Right.
And there's lots of folks who have sensory processing disorder proper who do not have autism or ADHD or other things.
Right.
And they don't discuss that at all, which I'm like, okay, well, step back, it's made by dentists. So I like that they want to talk about it and expose what that experience is like for people, but I feel like it's a very narrow view.
Right.
So for example, I've never been diagnosed, but I would say I definitely do have a lot of sensory sensitivities. Like my mom took me to one of my first concerts and we had to leave. I was hysterical crying within 5 minutes because it was just too loud. I literally physically could not sit there for the concert. And I really struggle with purchasing clothes because I have a lot of texture issues. I just recently realized that I don't like red meats because of the texture, not the flavor. And then I also have digestive issues, which I'm sure is associated, but it really only, I would say in the last 5 or 6 years, I realized that's why I never really liked meat or pork or things like that. It's the texture of those things.
Interesting.
And then I always joke and say I'm not a full-grown adult because I don't know how to order my meat because I avoided it for so long that I don't know like what temperature to order it so that it's the texture that I like. So that I think that's another reason why I continue to avoid it.
Right.
Yeah.
Now, do they differentiate between like sensory seeking and sensory avoiding?
No, they only talk about sensory overload.
Okay.
Which I'm glad you brought that up because those are the types of behaviors that result from sensory issues. So sensory seeking is when you need to have something. So we typically see this in people who need to have fidgets with them all the time, need to be moving their hands. Or sensory seeking can be, sorry, I was trying not to burp into the camera. Damn bubbles. Sensory seeking, which I think a lot of people don't understand, is a lot of people now, because it's more socially acceptable, will go around in public wearing headphones. And I think there's this misconception for some people, not not all of them, that it's because the world is too loud. But I think for some of them, they enjoy the weight on their ears. And that is soothing. Because I've talked to a lot of people who say they put the headphones on because they're worried about the noise, but sometimes they'll put the headphones when they're at home and they know it's not noisy.
Right.
And so I think that sensory of having something, or like a weighted blanket, that can be sensory seeking, where people really enjoy that and need that to settle down to rest.
I thought I liked a weighted blanket, but then I couldn't roll over in bed. And I was like, I can't roll over. It's too heavy.
I like the idea of a weighted blanket, but I get very hot very easily, so then I get uncomfortable.
Yeah, me too.
And I also have a sleep sack, which I really enjoyed. But then I started to like panic, like, oh my gosh, what if there's a fire and I can't get out because like your feet are wrapped up too. And mine has like little feetsy holes, but like you can't move your legs to like walk.
It's like what we put babies in, you know?
Exactly. It's like a swaddle, essentially. But I will tell you, I had the best nap of my life in that thing. But I don't know if I could sleep in it
the whole
every night, all the night. Yes. So that would be sensory seeking. Sensory avoidant behavior would be things like I said before, wearing the headphones because things are too loud, not wanting to leave your house because the senses are too much, avoiding certain department stores or grocery stores is a big one I think people don't realize. I'm going to name 3 stores. I want you to tell me which one you think is the darkest. Target, ShopRite, Whole Foods.
Darkest? Whole Foods.
Yep, you're right.
Yeah.
Because Whole Foods, if you think about the layout, most of them are more of a factory setting, but they don't have those bright fluorescent lights. They have almost like a dimmed light.
And they have like a concrete floor usually, so the floor is also a dark color.
And it tends to be cooler in there too.
Yeah.
So for sensory folks, they may prefer to shop in a store like that versus
That's why I like Whole Foods.
Yeah, exactly. It's a sensory thing. And I don't know if it started off intentionally for them as part of their marketing, although a lot of stores look into all of those factors to increase their shoppers and get more people in. So maybe it was considered, but I've had a lot of folks tell me that they prefer certain stores because of the lighting in the stores or struggle in their workplace because of lighting. So so we all know we have 5 senses. We technically have more than that, but I'm talking about the major 5 senses. So we have texture, so tactile, so that's texture. Olfactory, so that's scent. Vision, I'm like, what's the other one? Hearing, so sound. Taste, I'm like, what's the other?
You're like, what is the other?
What I literally just numbed. That's why I couldn't think of it, because of the taste.
Because I can't taste anymore.
So when we say sensory overload, it means one or more of those senses are being triggered in a way that is overwhelming to the person to the point where they get uncomfortable. And I work with a lot of people on the spectrum and a lot of people who, even if they're not on the spectrum, may have sensory sensitivities. And the way I hear it described most often is people want to jump out of their skin. They feel like they're going to die. They feel like they can't be in their body when they're having that sensory overload. Like it's almost described as kind of like a dissociation where like I'm away from my body. I know what I'm doing. I know it's me, but I can't be in my skin because the sensory stuff is too much. And I feel like it's very similar to what other people describe as a panic attack. You know, you feel really uncomfortable. You feel like something's wrong, this sense of doom. You just can't get comfortable. So I think sensory overload, sensory sensitivities are somewhat similar to that. I do think we know for a fact there are different underlying aspects of it. But I think for people who have never experienced it, that's probably the best way to describe it.
Okay.
So this film, Sensory Overload, let me give you a short and sweet synopsis of it. So it follows several different people. The first one follows a dentist named Dr. Jacob Dent.
What?
I know. He's a nice guy, though. He's a cool guy. And he actually has designed his practice around the needs of neurodivergent and sensory sensitive communities because he has a child who's on the spectrum.
Oh, that's cool.
Yeah. He was originally just a stereotypical regular dentist. And then once he saw the needs that his child had and was struggling to find someone to, a medical doctor, a dentist, he was like, wait a minute, I can do this stuff. And they show what he does in his practice. And it's a lot of stuff that I think some old school people might be like, well, that's not appropriate or that's not sanitary. But it's like he's doing it to make healthcare more accessible to these people. So one of the things that he does is for people, mostly kids, because he is a pediatric dentist, I believe. They only show him with kids, so that's why I think he's a pediatric dentist. One of the things is he doesn't make them sit in that dental chair. He'll sit down on the floor, propped up against the wall, and have them get comfortable on the floor. And then when they're ready, they'll lay their head in his lap, like on a pillow. And then he'll do his just general dental exam, poke around in there. He will play certain music, have the lighting be different, kind of walks people through these steps of a typical dental procedure in just a more thoughtful, sensitive way to, this is scary for most people. And then if you have sensory issues, it's going to be super scary.
Yeah.
But he's still giving them appropriate dental care. So it's like, well, if he can do that.
Why can't others?
Yeah. And I think part of it is that it takes him a lot more time. And we've talked about this before on the practice about how when you're working in healthcare, your time is very valuable, and that's dictated by insurance companies. They only allow you to have X amount of time with X amount of people. And so he didn't go into all of that, but I would assume he probably doesn't take most insurance, or if he does, there might be some out-of-pocket fee for these additional,
right, because he takes his time.
But he's really doing something that makes a difference for people. And I would imagine a lot of people who are just afraid of the dentist would enjoy having that ability to do those things differently and still get their dental care taken care of.
I mean, I've never been afraid of the dentist, but I have to think back. Like, I totally have I had some traumatic teeth injuries when I was younger.
I thought you were just going to say you had some traumatic teeth. I was like, wait, what?
Well, that too. But no, I had my baby teeth, my front teeth. I tripped on a nightgown and hit my teeth into a table and knocked them out. And I had to have like the root removed and blah, blah, blah. So that was kind of traumatizing. And then when the tooth grew back in, it was an adult tooth. I was in the dance studio hanging out when my sister was in class, and they had like leotards for sale. And the bar from the rack hit me it fell. And it hit me and it cracked my adult tooth in half. So then I had to have all kinds of dental work and a crown placed and all this like stuff done. I did not
know this about you.
Yeah, it's a fake tooth right there.
No one would have ever known.
It was, if I think about like the treatments for these fairly traumatic, because your parents not in the room. You're by yourself with like the weird dentist and his, whoever.
All the tools make really loud, weird noises.
Yeah, and you have to just sit still. And I remember them having like a TV with cartoons on. I remember one time I got gas. And I really remember, because that's, I think, the only time I ever had like any kind of anesthesia, like sort of like a dissociating thing, like feeling like my head and my body were not connected sort of a deal.
That's exactly how it works.
And so since then, I got my 2 wisdom teeth that I had, I only had 2 out of 4, pulled without general. I stayed awake. I did just local, because I don't know, I didn't like the feeling of the dissociation of whatever. But like, if I think back, there probably is some weird trauma from like having all this stuff done when I was a kid.
Yeah, I was the weird kid who loved the dentist because my dentist would give us prizes and he had a really cool fish tank and I really liked it. I didn't start hating the dentist until, I'd say like 2017, 2018. I got a hole. I didn't break a tooth, but there was a hole in my tooth. So I went to go get it repaired. And I'm in the dentist's office and I'm in the chair and the dentist is in there and then the dental hygienist gets in there. So there's 2 people in my mouth. And then they start having an argument. And I'm not just talking about like, oh, move your hand or me this, like yelling at each other while they're both in my mouth. And I just started to have a panic attack.
Yeah.
And ever since then, I have dreaded the dentist. And I know in my head it was that incident because I used to never care about the dentist before that. And I've been to the dentist multiple times since and it's been fine.
Yeah.
But it just, that one incident, it was just like, and I don't know, like they weren't arguing about me or anything. I don't even know. Honestly, like in retrospect, I wonder if they were like
together,
something on the side and arguing
spat,
about that. Yeah. Lovers quarrel in my mouth. But, and I also remember that day I was watching Ancient Aliens on TV, which is also a disturbing
There's always something random on the TV, right?
Yeah. So maybe it was the combination of the 2 things, but that was definitely when my dental anxiety began.
Yeah.
And it hasn't prevented me from going to the dentist, but still I can see how there's so many factors that go into just getting your teeth checked. And then they tell us we got to go twice a year.
Right. There's very few places that it's like that awkwardness of like someone inside your whatever orifice while you're awake.
Yeah.
You know what I mean? Like everything else. I mean, I guess the gynecologist, but
yeah, that's just for us ladies. Sorry, guys.
But yeah, there's few other interactions that it's that much.
I can tell you one because I always dealt with the problem kids from them. Speech therapists. Okay. When they're really little, they will put their hands in the kids' mouths to help them learn how to move their tongue or their jaw. And I've had a lot of little kids who, most of them were on the spectrum, now a stranger's sticking their hands in their mouth and now they're either biting them or they're having a meltdown and then the speech therapist can't work with them. So then they refer them to psychology. And I'm like, well, you shoved your hand in a kid's mouth.
Yeah,
so what do you want?
Yeah, you invaded my space.
Yeah, which I get it. They're just trying to do their jobs. They're trying to get their work done. But like, think of the experience for a small child who already has communication issues.
Right.
And now you've shoved your hand right in their mouth. Like,
I'm going to be overloaded after this episode.
I'm sorry.
And I'm not even an anxious person whatsoever. Like, I'm the opposite of that.
That's why you've got to drink. Calm you down.
Although, after yesterday helping my child edit her book summary, I felt like I was overloaded and needed a drink. It was one big run-on sentence with no periods or punctuation, and everything was, and then. And then. And then. I was like, I'm overloaded.
Oh my gosh. So, and then the other people in this show, thank you for that segue. It says the film follows Lola Dadaoli. I'm probably pronouncing her name wrong, but she's a mom and she has 2 kiddos on the spectrum. One is low support needs. One is higher support needs, but not highest support needs. So for listeners who don't know about that terminology, we no longer use low functioning and high functioning. We talk about support needs. So if you have low support needs, you would have formerly been called high functioning. And basically, we're just trying to not use those pejorative terms or be judgy about, oh, you're better than this person. You're all on the spectrum, just saying what that person needs at that time, because with autism, support needs change over time. So you may be a low support need at one time, and then you're going through a crisis and you might be a moderate support need at another time.
Mm-hmm.
So she has 2 kids on the spectrum. So she kind of talks about the mom perspective of having to manage their different sensory needs, because one of her children is very sensory seeking. So needs the music playing loud volume, needs like all that high stuff. And then her other child needs the more lower sensory input. And so trying to balance that in like your normal day. And then just trying to advocate and help people understand the sensory issues associated with autism. She has a podcast and does a lot of amazing things. And then they follow an individual named Burnett Grant, and he has autism, and he works to advocate for more inclusive environments, particularly in the workplace. And so he has a job working in quality control in a food processing plant. I don't remember which one. They do talk about it though, like they actually say like the brand name. So I'm guessing they're on board with him. But he talks about how he struggled for a very long time socially, going out to bars, meeting people, struggled in school to make friends, struggled in a lot of ways, but most of the ways he's talking about are the sensory needs. And then talked about how he was very, very nervous to enter the workplace, because a lot of times, if you think about it, we've all worked in a workplace that wasn't the most comfortable for us, but we just sucked it up and dealt with it.
Right.
Where for him, he literally could not concentrate on his work. He could not do his work if those sensory things were not in place. And so bless his heart, like he's an amazing guy. He advocated for himself with his workplace, and they gave him what he needed. And now he does really well, and he works great. And he does do a lot of solo work just because that's easier for him. But, he's able to go about his day-to-day work and earn a good living and have a good professional job because he spoke up for what he needed, and his company heard him, and they went along with it. So it was really nice to see that. And then they talk with some of his coworkers about what he needs and how they support him and how there are things that they hadn't thought of as being people who don't have those sensory needs. And then there's another part in it that they don't really talk about, but there's this guy who looks exactly like him. So I think it's his twin brother or a brother.
Okay.
But it seems like this person may also be on the spectrum, but definitely has different needs. So they didn't really talk too much about that. They talked more about those differences in needs with the mom and her 2 kids. But sensory needs can vary greatly from one person to another. So what some person can tolerate with no issue, another person may find really impossible to deal with. So
it's pretty interesting that a lot of the accommodations probably are little to no cost or anything to the company. So if you really do ask for it, it does make sense if you're going to then be able to be productive. But we don't think about it. We think of everything. I think we come from a time, maybe people now are a little bit more about asking for things, but we come from a time where you just do, and you just don't ask, and you don't impose, or you don't. But I think it makes sense if this can make me more productive for you.
Yeah. And if you think about it, luckily now schools are being more aware of sensory needs and sensory inclusivity. We've all heard about, 20, 30 years ago, the ADHD kid was just bad and he got sent to the principal's office because he was disruptive. Now we have, an allowance for using fidgets if they're not too disruptive.
Yes.
The sensory seats, bands on your chair. There's lots of those type of sensory accommodations that we've made. That's more the sensory need to move versus these other sensory things. But, there's a lot of things that we do now to make environments better for people that were unheard of in the past. And like you said, don't really cost a whole lot, or keeping that child in the environment where they learn best, because they may not have a learning disorder. So they should be in a regular classroom. They just need some of those movements issues. So movement breaks, that's a big thing that I recommend for kiddos who I'm making a diagnosis with, who have a lot of excess energy. So, if your class is an hour long and you let the kids have a 15-minute break, well, he may need a 5-minute sensory break in the middle of that hour. He might need to be able to walk out in the hallway,
That can be written into a 504 plan. Mm-hmm. I've seen that done. Yeah, or an IEP.
which we won't get into because those vary greatly from state to state.
Right. I just have another little anecdote on this afternoon on the way where I was just driving child number 2 in the car, and I was asking like, oh, I'm going to your field trip tomorrow, so you don't have to go to before care. Like I can, just bring you to the school and then I'll just stay. She's like, no, I like to go to before care because before care, I run around and I get my morning energy out. Mm-hmm. And then recess, I get my middle of the day energy out. And then at aftercare, I get my afternoon energy out. And it was funny because she was able to verbalize like, I need that release. Yeah. I don't want to stay home. I'd rather get up an hour earlier, go to before care so I can get all the sillies out.
Well, and I love that for her because she's realized what works for her and what doesn't.
Yeah.
And so changing that, she knows that's not going to be her best day and she wants to enjoy her field trip. So good for her.
Yeah. I thought it was pretty neat.
I'm also glad that you mentioned that because I think what happens a lot of times in kiddos who have sensory issues is sometimes they can explain why they have the sensory need or the sensory aversion, but sometimes they can't. And then people jump to a lot of judgmental conclusions about it. So doing the best you can to help your child communicate what those sensory needs are, even if you don't understand them, just help them put it to words so you understand what they need and then you can advocate for them. So let me talk first about what sensory processing disorder is, and then I'm going to talk about a couple other things. So sensory processing disorder, SPD, essentially it is a difference in the way that your brain processes sensory information. There's different types of it. So there can be auditory processing disorder, which obviously is about processing auditory information that tends not to be looped in with sensory processing. But as we just said, audition is part of your senses. So I felt like it was relevant to talk about here. What we typically see are people being overwhelmed or under responsive to certain sensory experiences. Typically, it's sound and texture. Those are the two big ones. We don't see as much visual unless it's like bright lights, things like that. And I think what a lot of people take for granted is sensory needs that I just lost my train of thought. So I'll circle back to that. Figured if I threw in enough filler words, it would pop back in my head, but it didn't. Sorry, folks. So sensory processing disorder, I just said what it is. Healthcare providers can typically identify it. It is not a psychological disorder. So me as a psychologist, I cannot diagnose it. To my knowledge, I believe it's also not an official medical diagnosis.
Right. I was going to say, like, it's a word I've heard, but I don't, was it ever officially recognized?
So we don't know what big old book it is in, but I do know that occupational therapists can diagnose it. So I don't know what codes they use. I don't believe they use ICD-10 codes, and they definitely don't use DSM-5 codes.
Okay.
So whatever codes they do use, it is in there because it is a thing.
Right.
It's like, so an example is a lot of times people will throw around other terms that are not diagnoses as of yet. So one I've heard a lot lately is pathological demand avoidance. That is a cluster of symptoms. It is not a diagnosis, but a lot of people are talking about it like it's a diagnosis. Well, I can't call it that as a professional because it's not within my scope of practice. Same thing with sensory processing disorder. I can't say that that's a diagnosis. It's not within my scope of practice, but I can say it's a cluster of symptoms and this person's having difficulty with it.
Okay.
So like I said, I have to look into who can officially diagnose it because I've seen it something on reports, typically from occupational therapists. So there must be something.
I wonder if a neurologist has some sort of other name or other.
And I'm sure there's other official names for insurance companies to justify services. Typically, when you're meeting somebody who has sensory processing disorder, they also have other neurodevelopmental issues, but not everyone with SPD has that. So the typical ones, like I said before, are autism and ADHD, but it can occur in other disorders. The Novocaine went to my brain, apparently. It's like, whoa. Okay, so like I said before, this is what I was going to say before. So sensory over responsivity is when you're too sensitive to things. So one thing that I think a lot of people can relate to is some people are too sensitive to certain medications. So some people can't take a Benadryl because then they're like knocked out dead for like hours and hours and hours when that's not how that's supposed to work. That is not what I'm talking about. It's just what other people can relate to about being more sensitive to that than others. Sensory under responsivity, a big one that I see in folks on the spectrum that a lot of people miss is under responsivity to pain and illness. So for a very long time, there was an assumption that it was because those folks couldn't communicate their pain or their illness. But we do have a feeling now, knowing more about sensory processing, that they're just not responding to it in the same way.
Wow.
And so that's why, you hear these stories. I have a cousin who he fell and he broke his leg, and 3 places and was seriously injured, but like outwardly, even though they knew he was in discomfort, he wasn't, excessively crying or screaming or things like that. They just were like, okay, he's not himself. He's not, he can't really get up and walk. Like something's wrong.
Right.
So with him, he does have a lot of communication challenges. So it could be that was part of why he couldn't communicate his pain, but also what we are expecting people to look like when they're in pain, with that smiley face chart that we've all seen about the smile to the sad face about pain. I think a lot of folks who are neurodivergent may not respond to pain in the same way. So being aware of that when you're working with those folks. Other types of sensory processing issues can be sensory craving. So that is sort of like sensory seeking, like I was saying, where you're seeking out the sensory information or stimulation. And what happens is when you get that stimulation, sometimes it kind of sets you off even more. So the example that I think a lot of people may visually see is stimming. So people are stimming to regulate. But then if you stim too much, then they kind of get stuck in a stim cycle. And now you're stimming more and more and more.
Like a loop.
And it's no longer calming. Yeah. And so it's not satisfying that sensory seeking behavior. But the core of stimming behavior, which I'm not going to get into today, it's not something that we necessarily want people to stop. We just want them to be able to make it work the way they need it to make it be able to regulate. And then obviously there's a lot of controversy about, do we try to make it socially acceptable? Do we try to stop stimming behavior? I think it really depends on the individual and what they need.
I think like making it work for them, like making it being a tool in their toolbox, but not, like you said,
not
getting into that.
Yeah.
Right.
Like I've met a lot of adults who have high sensory stim needs. So they need to jump, they need to bounce, they need to do a lot of that, but they know they can't do that in the workplace. So they hold it in and then they do it when they get home. Or I had a woman recently who she had a lot of vocal stims that she needed to do that she would hold in at work, and then she'd go out to her car and she'd do it. And then she'd come back in.
That's hard.
Yeah. I was thinking that when she told me, I was like, that feels like torture to have to hold that in all day to go release it. But she said, well, I like my job and I want to keep it. So I don't want people to think I'm a weirdo by, screaming. But
there's such like varying degrees, right? So that's a more extreme degree, but there could be other subtle things that somebody's doing that you don't even realize. Rubbing something, cracking their knuckles, like there's things that they might be doing that are giving them that, and that's all they need. And there's a spectrum, I'm sure, of that even.
Absolutely. I met another fellow on the spectrum who one of his sensory needs was pacing. That's another big one in folks on the spectrum. But luckily he worked in a very large building, so he could get up and walk up and down the hallway a couple of times if he needed to. And nobody knew the difference, but he knew. He knew that he needed that. So like for him, he was able to do what he needed without changing what he needed. And no one else really realized or it was turned off by it. Sensory discrimination disorder. So this is one, I don't see it talked about a lot in like OT reports, medical reports, but we tend to see it more often in like the really little ones, like 2 to 3, when we're first noticing that they have sensory differences. So they can't necessarily discriminate between different sounds. And so that kind of trickles a little bit into auditory processing disorder, but not fully. But basically, the way I just saw it described in a report was really beautiful about how when babies are born, you have different sensory needs, and they're supposed to be integrated as you grow older and get accustomed to the world.
Okay.
Sensory processing disorder is when you're not integrating those things to be able to function in the world better. And I was like, that's an amazing description of it.
Yeah.
So like an example, this wasn't in the report, but the first thing I thought of is like, a tiny baby is going to scream their head off when they need something. We want a 4-year-old to not scream their head off when they need something. But if they haven't integrated that need into a way to communicate that differently or to deal with that sensation differently, they're still going to use that kind of primitive way of responding in your sensory needs.
Yeah. So child number 2 used to have to rub my arm when she was nursing to go to sleep. Rub, 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 rub. And then we would find her in her bed
rubbing her arm
with her little pajama sleeves all the way up every morning because she would rub her own arms like that. I don't think she does it now because it integrated.
Yeah.
But for a long time, that was something she needed.
Yeah, it's soothing.
To soothe.
Yeah. And I think that's a good example because what people don't understand about these sensory things, it's a way of self-soothing.
Right.
And for a very long time in psychology, we always kind of blamed, and I hate this, but I'm using it as an example because it was there for a long time, women who were very sexually active. They were saying, oh, she didn't know how to self-soothe, so now she's got to go,
Oh, God.
or, women who took control of their own pleasure,
Right.
oh, well, she doesn't know how to self-soothe. Well, why was it only women?
Right,
But whatever. But there's been a lot of talk in psychology about the ability to self-soothe and self-regulate for a very long time. And for a very long time, it was pathologized. And now we're trying to move a little bit away from that and give more understanding to these literal physical needs that we all have. Just some people have it stronger than others. Another type of sensory processing is a postural disorder. So this is more of that proprioception, knowing where your body is in space and knowing how to navigate the area. So I think what most typical people would see of somebody who has that type of sensory disorder are the kids who are super clumsy, walking in the walls, falling down all the time, moving too fast, or moving too slow. And those are typically the kids who get pegged for physical therapy pretty quickly because they end up with an injury, and then they go to PT, and then the PT is like, wait, this is what's going on, and can kind of figure out that stuff. And
we don't realize how important our therapists are. PTs and OTs and speech therapists, they are like...
They're phenomenal, yeah.
Because they're spending that time to really get to the bottom of these kind of things.
And they can help with so many things that other doctors or professionals aren't even aware of.
Right.
Another thing, just because we're giving a shout out, is if you've got a little one who's really struggling with toileting, there's certain OTs who specialize in that. So that can be really tough for a lot of parents who don't know where to go with that, but it could be being aware of that sensory need of your body and toileting and when to go. So your kid's not having accidents for fun. Most of them aren't. And then dyspraxia. Do you know what dyspraxia is?
Dyspraxia. I know apraxia is.
Okay.
So praxia speech, dys is bad. No. Apraxia is you can't, I don't know.
Dyspraxia is about gross and fine motor movement. So you were right where you can't do it right, but it's more of the movement aspect of the praxias. So like we were just talking before, this is kind of interesting. Some tests, quote unquote, for sensory processing disorder. So some of them I just talked about, constantly bumping into things, being clumsy, discomfort in certain fabrics or clothing, gagging when eating certain food textures, needing to constantly touch things, not recognizing personal space, reacting in like a startle response to sudden movements, touches, loud noises, bright lights, trouble using fine motor skills, so handwriting, that's going to be usually the first one that we catch just because of school. But some other really cool ones that I've never thought about is if someone can spin without getting dizzy.
Yeah.
I was like, okay, that makes sense. Constantly moving, more of that hyperactivity that we tend to see, that's part of a sensory need. And then poor body awareness, like I was talking about. I think this here is something that we also take for granted when people are not aware of personal space, where they get too close to you when they're talking, or the opposite that I see in a lot of folks on the spectrum, they're way too far away and they don't realize it.
Right.
Another one that may come up when I move on to auditory processing disorder in a minute is talking too loudly, like not being able to modulate your voice. That's a sensory thing. Maybe you can't hear yourself, or maybe you can't hear someone else, so you feel like you need to speak up. But other risk factors or comorbid conditions for sensory processing disorder, other than ADHD and autism, bipolar, disruptive mood dysregulation disorder, OCD, schizophrenia, certain learning disorders, and developmental delays. So this is occurring in way more people than we originally thought. So obviously, if you've got a little one and you think that they may have this, you want to start off with a pediatrician, and then they may make a referral to an occupational therapist for that. And then, like I said, in occupational therapy, they're going to work on treating those things. I'm not going to go down that rabbit hole, one, because I'm not an occupational therapist, so I don't want to give people wrong treatment advice, but those really are the true professionals about it. So talk to somebody who's an OT, or look up on some OT websites about how they actually treat it, but they do have like a set kind of protocol for the way that they treat certain things and for certain lengths of time and all that good stuff. There are certain sensory things that, again, I'm not an OT, but if they've gone on for long enough, you're no longer going to try to correct it, and you're just going to try to adjust to it. So the perfect example I can think of is pencil grip. If you don't catch and correct pencil grip in childhood, you're never going to change it. So I've met more than one adult who writes like this.
I have a gym teacher from elementary school who literally wrote like that.
Right. But if you can write and you can write legibly, why do we need to fix your pencil grip at that point? So as long as you're functional, that's really what the goal is for any of this stuff. So auditory processing disorder, it is considered a type of hearing loss, but it is when there's something that's affecting the brain and how you are processing auditory information. So sometimes damage to the ear can result in auditory processing disorder, but it can also happen to anyone. So central auditory processing disorder is the one that can happen in anyone. And it is quite common, like I said, in ADHD and autism. But it can also be related to other types of hearing loss. So if someone's had a traumatic brain injury and it's affected their hearing, or if you've had exposure to blast or something too loud, it can also affect your ability to process auditory information. There is no cure, so you're learning to adapt and adjust to it. And the way that we get diagnosed with that is by an audiologist, and you might have to have a referral from your pediatrician, your primary care, or an ear, nose, and throat doctor first, because they would do some other things to rule out what's causing this before jumping automatically to auditory processing disorder. Some of the symptoms of that is not being able to tell where a sound is coming from. So you hear the sound, but you can't do the location of it. Not being able to understand words that are spoken quickly, so literally every word that I say, or understand things when there's a lot of background noise, so a crowded room, at a party, difficulty paying attention, difficulty with reading and spelling. So why do you think that comes up? Because I think a lot of people miss that connection.
I'd like to know. I'm curious, actually.
So especially in our U.S. education system, the majority of learning is verbal. Someone is talking to you about something, and then you read it. If someone is talking to you about something and it's a word you've only heard and never seen, you now have to figure out how to spell it. Or if they've only said it out loud and you've never seen it on the paper, you may not connect that to being the same word that you're reading.
Right.
So you can have difficulty with reading and spelling with that. Difficulty following directions unless they're very short, because processing the auditory information, some of them might get lost.
But does this fall under a lot of overlaps with ADHD and dyslexia? Because I feel like it all sort of jumbles together after a while. Like you can't separate out what's what.
So it overlaps. What the difference is auditory processing is going to come up on an audiological exam.
Okay.
If it's coming from ADHD, it may be the same symptoms, but it's not going to come up as a hearing issue. It'll come up more on neuropsych testing or psychological testing. Now, that being said, if you go and get a neuropsych test or psych test for ADHD, there are certain tests that I'll do that I'll be like, something's still going on with your hearing, go get an auditory processing evaluation. So I can still diagnose you with ADHD and still worry that there's auditory processing going on.
Do you know, other than a normal just hearing test, what they would do?
I know that they're very specific tests, specific tones, different types of background noise, distances, lots of...
I'm curious because you're saying about the retaining that you're hearing a word and then reading a word. Mm-hmm. That's what English is crazy, and the way we spell things is crazy, and there's 5 words that sound the same and are spelled differently.
And then we've got enog, or the word enough, which makes no fucking sense.
You're right. We don't make it easy.
It's actually enauge.
Well, if you're Irish,
I've had
Scottish.
enough enauge.
We don't make it easy.
Yeah, we don't make it easy. And I could go on a whole tangent about why English is as effed up as it is, but that's for another time and place. Because I actually did learn about that when I had briefly worked in teaching phonics, which is all about this, how you say the words, how you shape the words in your mouth, but that's a whole other thing.
Can you do tutoring?
I can, for a nominal fee. Yeah, I was certified. I still have all my books and stuff for that too. I'm looking down because they're right over there. So
you still literally have them.
I literally have all the stuff. Yeah, but these two things are interesting because I think people take them for granted. Learning a different language than your natural language is where some of this may come up. Because, like, as you just alluded to, like, there's different pronunciations, different sounds for letters in other languages, and if you don't have it solid in your native language, you're not going to be able to learn it in a new language.
Right. And even grammatical tenses and just so many things.
Yeah. Singing or enjoying music can be really difficult for people with auditory processing disorder. And then understanding and remembering spoken information. So that's the good thing about the American educational system is most things are supplemented by written materials. But if you've got a reading disorder and auditory processing disorder, that's not going to help out. Right. At least there's some attempts there. And then other things that people may notice is constantly asking people to repeat themselves, like not catching the whole thing. Mm-hmm. Taking longer to reply to someone who's spoken to you because you're processing what they said and you need a moment. Mm-hmm. That being said, processing speed is different from auditory processing disorder. I'm not going to go down that rabbit hole, but it is a different thing. And then not understanding sarcasm or jokes. I have a theory about that, though. If we really think about it, when people are being sarcastic or telling a joke, they tend to talk a little bit faster.
Mm-hmm.
So I wonder if it's more the speed of the information versus the actual information.
Hmm.
Or like your tone changes when you're saying those things. So maybe it's the tone throwing it off of the processing, you know? I feel like there's a little bit more there to sarcasm and jokes than to that other stuff.
Yeah.
So risk factors for auditory processing disorder. If you're not diagnosed with it in childhood, some factors are aging, stroke, head trauma, lead poisoning, seizure disorders, repeated ear infections, especially at a young age, and then substance use. So complications, all the stuff I just told you about, like difficulty understanding things, isolating, not doing well in school. And then, like I said before, there's really no cure. So just kind of learning to adjust to it. I'm trying to find, oh, wait, here you go. So you asked before about specific tests. I've not given these tests. I can't tell you any details other than the names of them and very brief information. So tympanometry, so
that's
your eardrum.
The tympanic membrane.
Yep. So making sure that your eardrum is reverberating the way that it should appropriately for hearing. So that's one thing. And that's really just putting pressure in the ear to see how it responds to the eardrum. Fun fact, I punctured my own eardrum a couple years ago. It was the most painful thing in my life. Don't do it.
Did you do it with a Q-tip?
No, I did not. I had an ear infection that I wasn't fully convinced was an ear infection. And then the pressure built so much that it punctured it. Yeah, it was.
Most people do this though
with a Q-tip.
With a Q-tip.
Yeah.
Okay, this is my PSA for the podcast.
Don't use Q-tips.
Do not put anything smaller than your elbow in your ear.
I can't get my elbow in my ear.
Exactly.
So another test that they can do is the acoustic reflex test. So that's looking at what happens inside the ear, the inner workings of the ear in response to a loud sound.
Okay.
So seeing if the ear is responding to the loud sound. And there's an auditory brainstem response. So this is looking more further into the ear to the cochlea and making sure that the pathways from the cochlea to the brain are actually working. So that's more of a neurological test, but the audiologist kind of starts that. They put sensors on around the ear and around the head, connect them to a computer. You listen to clicking sounds and then seeing like what's firing as that's happening.
Got it. Yeah.
I just swallowed a little bit of Novocaine seed and
are you going to start like choking and not being able to breathe?
This side of my throat is a little tingly. I will say it doesn't last long. Like when I said the tip of my tongue, that lasted maybe 2 minutes.
Like who decided this was okay? Didn't somebody be like, I think this is poison. Why did I ingest this?
It's not poison, and it was actually a natural medicine in China, I believe, for people who had mouth pain.
I mean,
you just chewed on the
makes sense. Yeah.
And then the last test for auditory processing disorder is the evoked potential test.
Oh, I know what that is.
And that's tracking how well sound travels along the nerves that connect the ears and the brain.
Got it. They do that evoked potentials for vision and for sound, I believe, for MS.
Yeah, because when those nerves start to demyelinate as an MS, then you start to have difficulty. We need to do an episode on MS because I love Selma Blair and I love Christina Applegate and they are warriors, and we need to talk about that more.
I mean, I think that's media in itself. I don't even think we need a specific piece because they are media.
And they're so much of an advocate about learning more and understanding.
Absolutely.
Well, actually, Selma Blair has her documentary that I watched about her MS treatment.
Oh. Well, put it on the list.
It's on the list. And then treatments for auditory processing disorder, depending on how severe it is. You may have a hearing aid or a listening device, things that I've seen children who have APD, auditory processing disorder, in school use an FM system. So it's a frequency modulated system where essentially like it's a little box and they wear headphones and they can hear better in the classroom the teacher speaking.
Okay.
Auditory training or hearing rehabilitation can help you adjust. So you're not necessarily changing it. You're just learning how to compensate for that difficulty. And then there can also be computer-based training where you basically are retraining your brain how to process information. And then some other lifestyle and home remedies from the Mayo Clinic. They have like the weirdest categories on here. Move closer to the person who's speaking to you. Think about covering surfaces that make echoes. Move away from other sources of noise. Ask someone else to take notes for you or get a written copy of what is said. Ask for anything important in writing and use subtitles when watching TV. So those are practical things that make sense. And then if you're bringing your child or loved one for an evaluation, the things you want to write down are some of the symptoms, when they began, things that feel like they don't make sense and aren't adding up, any personal information, including recent life changes, illnesses, injuries, medical history, stressors, a list of vitamins, medicines, and supplements, because certain medications can impact your hearing. So that's important to know. And then just any other questions about the symptoms that you're seeing, bring those up to your doctor. And then the last thing I have is how to manage sensory overload in general in adults.
Okay.
Because that's a lot of what that documentary is about, is it in adults. And so I think part of it is awareness, understanding that people have different sensory needs, being aware of the sensory issues in any given setting. So what I'm thinking of is like, if you have a friend who has sensory overload, are you going to invite them to the crowded bar? Are you going to bring them to, the quiet little cigar lounge? Both of them have sensory issues. The cigar lounge might have a lot of smoke. It might not be great for them, but the bar might be really loud and crowded and music and too many voices. So like kind of thinking of things that you can do to support your loved ones while keeping their sensory needs in mind. So like we talked about before, sights, lights, brightly covered packaging in like stores, overwhelming crowds, noisy traffic, honking sirens, loud music, walking into a building that has strong chemical odors, going to one of my favorite places, but it is a sensory overload, Lush. Love that store, but bam, those scents hit you when you walk right in the door.
In general, any of those places. Yeah.
Any of those bath, body care places. They're great places. They have great
Yankee
products.
Candle.
Yeah. But if you're sensitive to that, it's going to be a really difficult place for you to be, or even to walk by, because some of that you can kind of smell from outside the store. Touch, being aware of tags in clothing. More and more clothing is now tagless. So that's good.
It's so true. Think about when we were kids, what the tags used to be, like those scratchy tags. Now it's either printed on it or it's like a very soft material.
Or what people used to do when we were younger, which I didn't really care so much, but I'm like, if you don't like tags, it's going to make you worse. Putting tags in your clothing that had your name on it. Like if you're going away to summer camp or something, sewing in a whole brand new damn tag. Like, no.
Now I just write with a permanent marker on the tag that's in there.
Exactly. Other things that people forget about the touch, the tactile sensitivity, temperature. That's a big one that really throws a lot of people off. So summertime extreme heat, wintertime extreme cold can be really difficult for people. And what I've heard from a lot of folks who have sensory processing issues is that, like, for example, the hot and humid summers in New Jersey can be really brutal sometimes. Those folks, they tend to avoid going out in the summer. They tend to avoid some of those summertime beach activities because they know they're going to be so uncomfortable. So it's like, okay, well, what else can we do to make summertime fun for you?
Right.
And then taste. So, strong flavors, overpowering scents on your food. One thing I see for some reason in a lot of like really littles who have autism or who are on the spectrum is a lot of the parents are like, oh, they're a picky eater. They don't want to eat this. They don't want to eat that. They are craving that sensory intensity for taste. So like I've met like 2- and 3-year-olds who like will only eat like hot Cheetos and jalapenos and things like that. I'm like, oh, because everything else probably tastes dull to them. But they need like that shock to like actually taste the flavor in something. And
that's sort of the opposite of the kids who have like the ARIFD and all that. That's like sort of the opposite.
Yeah.
Right.
Yeah. So like some people, when we're saying that they're a picky eater and they avoid a lot of foods, sometimes it is due to the flavor profile versus the texture. But I think we automatically go to textures because that's so easy to see in certain foods or to understand in certain foods. Proprioception, like we talked about before, where your body is in space. Are you going to misjudge, carrying something, moving a certain way, reaching for something? Your vestibular sense, so that your balance, the position of your head, particularly in space. So, if you're feeling queasy on a boat and you've got vestibular problems, you're going to be like the first to hit the floor versus just being a guy who like grabs the railing, so being careful. And then the interoception, like I said, understanding your bodily needs, hunger, thirst, bathroom. I think, unfortunately, and I was just listening to a different podcast today that was talking a little bit about this. I think a lot of us in the professional working world are trained to ignore our physical needs. So the example that was given was about how you've had to pee for 3 hours, but you have patient after patient after patient. So you just hold it in. And it's like, what? Like other jobs wouldn't do that. Other people wouldn't do that. But I think a lot of people learn to ignore their physical internal needs. And then that can cause problems, not just a UTI or discomfort. Like the more we ignore those, the harder it is to realize later on when we no longer need to ignore them.
Right.
Another one that I am the most guilty of. How much water have I drank in the last week?
Oh God. You're like chronically like dehydrated.
Maybe a bottle, maybe one like bottle of water, maybe. And then hunger, I will say, so I think I talked about this in the podcast already, but I had gastric bypass. And when I had that, they removed a lot of my intestine. And so I don't know, they removed too much of my intestine. So I have some issues from that. But one thing I noticed that I don't know it was from the gastric bypass, it was from that part of it, the removal of the intestine or something else. But I don't have a sense of when I'm hungry. Ever. I can hear my stomach growling and say, oh, I'm hungry. But I remember from pre-gastric bypass days, that feeling of hunger as well, in addition to the stomach growling. I don't get that feeling anymore. And it's the most bizarre thing in the world.
It is weird. Yeah.
Like, I eat based on time.
Right.
I'm like, oh, it's dinner time. Oh, it's breakfast time. I don't eat based on hunger. And then the few times that I am hungry, it doesn't feel the way it used to feel. It feels very different.
Like a gnawing, weird sensation.
No, it doesn't even feel discomfort. It feels more of like if, I guess similar to like, I think I have to go to the bathroom, but I don't know. Like, everybody's had that where they're like, I should go try. You know? And then you go and then nothing happens. It's kind of like that.
Huh.
Where it's like, I think I should probably eat something. I don't know. Let's try. And based on my current weight, you can see it's never a no. But I don't get that hunger drive is what I'm saying. So
interesting.
There can be other reasons why you could have issues with your senses. So that's one example. So that's what I've got today. I was like, oh, this is going to be a super short episode. I got nothing to say.
You see, I give you free reign and you just go.
Just don't shut up, unfortunately. Sorry, guys.
That's okay. It still left a little more relaxation room, I think, in the middle where we can chit and chat and not be worried about the time. So I think either whether the length of the episode's the same or not, it just has a more natural of us just being able to talk about it. So I think it's pretty cool.
And I think, too, like we did today, it's going to give us ideas of other things to talk about. And
I know.
Less
write that down. Person in the back room that we don't have.
I don't know who's back
Someone Blair. Write it down.
Someone who's listening, write it down and email it to us.
Yeah.
We'll put you on the staff. Sorry, there's no pay.
Yeah. 0 budget.
We'll get there.
All right. So follow us on all the socials. Please interact. I put up a little poll. I don't know if anybody answered it. I put up a picture. Well, this will come out 2 weeks after that picture came out, but I was like, I made some AI pictures of myself. I'm like, which one do you like better? Interact. Answer my questions. Answer my poll.
I guess that means I have to do the AI picture now, too.
Yes, you do. Please.
Okay.
But yeah, hit us up on socials, chit chat with us, send us an email. We're on everything. We've told you where we are. It's on our website. It's on all of our links at the bottom of our show notes. So, Medical Media Mixer Podcast. I actually changed the name on some of them to say the word podcast in our name now, just to make it even more clear. So TikTok and Instagram, everything, Medical Media Mixer Podcast, wherever you look that up, you can find us.
And if you're new to joining us, thank you for listening. Continue to listen. Send us an email to medicalmediamixerpodcast@gmail.com.
No, that I didn't change.
medicalmediamixer@gmail.com. I'm still manning the email box, not consistently because I'm a bad person.
No, you were on vacation.
I was away.
That's allowed.
But shoot us an email. Tell us what you like. Tell us what you didn't like, because we are open to feedback and we can't wait to hear from you guys.
Yes. So thank you for listening to Medical Media Mixer.
The perfect cocktail. Cheers.
Cheers.